Hello everyone, I'm Dr. Tawsif Mir and I'm a first year psychiatry resident at Grand Medical College and Sir JJ Group of Hospitals, Mumbai. And today I'm going to solve all the doubts that most of the people have before choosing psychiatry as a branch. So I'm going to solve all the doubts that common doubts that people have. Let's start with a basic misconception that people have that psychiatry तो बहुत easy है बस बात करने होता है. So hell no. So it's not just sitting inside a AC room and sipping coffee while patients pour their hearts out in front of you. So it's not like that. You are a physician first and psychiatrist second, right? So you need to know the medicine, neurology, or pharmacology, and obviously human psychology in a way that no textbook can teach you, right? So you're dealing with the with the illness that don't show up on CT scan or MRI, but can destroy lives, right? So your stethoscope is not your main weapon. Your mind is. So that is the most important thing you should know. Now, first, let's start with the basic that what psychiatry actually is. So, psychiatry is a medical specialty mainly focused on diagnosing, treating, and preventing mental or emotional or behavioral issues. So, it's not just talking. It it involves like structured clinical interviews or mental status examination or risk assessments, medical workups, and a proper evidence based treating approach. So your patient might have depression or anxiety or like bipolar disorder or OCD or PTSD, and often like more than one at the same time. And 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 yes, sometimes the first thing you do is to rule out a neurological condition or a metabolic abnormality or a medication side effect before you even start thinking of a psychiatric diagnosis. So these are the things you do. Now, mainly, I'm a psychiatrist resident at Grand Medical College. So at JJ, you go through postings like OPD, IPT, or emergency psychiatry, or some referral from the other wards, and a specialty clinic like child and adolescent psychiatry, or psychosexual clinics, or geriatric posting, or neuropsychiatry. So you also rotate in neurology and medicine because like obviously the brain doesn't exist in isolation from the body, so you have to know all the things. So the thing is that the common misconception that you will face, that people will assume your job is easy because you are not running through ICUs or something. So they will not see the emotional weight you carry when a patient tells you that they want to die. So, or when you have to break the news to a family member that their loved one's illness is lifelong. So, but you hear things like you are a doctor, no? So why aren't you doing surgery, or how can you treat without diagnostic tests or something? So, and you will have to explain that psychiatric illnesses have as much biological basis as diabetes or hypertension, or even if the patient does not even if the proof does not show up on X-ray or something, CT scan or MRI. So yeah, next question that people commonly ask is, uh, what about violent patients? So yeah, most like there will be times when the patients become aggressive, and this can happen when patient is in acute psychosis or mania or substance intoxications or something. So first remember that it's not personal, it's the illness, obviously. Second is safety comes first. So you will learn de-escalations technique like verbal de-escalation, or maintaining a safe physical distance, or ensuring that exits are clear, and calling for security personnel when you need help. So in certain situations, you may need rapid sedation with medications, and yeah, at times physical restraints are also used, but obviously always ethically, and always to be documented, and always as a last resort, you know and over the time you will get better, like you'll get better spotting early signs of agitations and preventing escalations. So you will learn this throughout your residency. So it's not a big issue, you know. Now, another thing is that emotional impact on you. So yeah, to some extent psychiatry can affect your personal life. Like, you will hear traumatic stories and you will work with people in depths of hopelessness. So you might go home thinking about uh, whether that suicidal patient you saw in the afternoon is still alive or not. So, but boundaries are essential, you know. So you will have to learn to leave work at work, and to have a support system, and to have hobbies, and to take care of your own mental health. It's very important. And if you don't, then burnout is real. Compassion fatigue is real, but so is compassion satisfaction. You know, so the feeling when a patient says that I'm feeling better for the first time in years. So it's so satisfying to hear that kind of thing. You know, from a patient. So it's another aspect of psychiatry. Now another is that one common myth that people have, that if you're a psychiatrist you must be analyzing me right now. The truth is, outside of work we're just humans, right? So we don't carry we don't carry what to say, mental clipboard, you know, to every dinner or every coffee date. But yes, psychiatry trains you to notice patterns in people's behavior or emotions or speech. So that doesn't mean that you psychoanalyze every friend or every partner. It does not mean that you become more it matlab, it does not mean that you psychoanalyze every friend or every partner, but it does mean that you may become more empathetic, better at listening to people, and more aware about mental health red flags in yourself and others. So that is the most important thing. Okay. Now, a lifestyle and talking about lifestyle and workload. So psychiatry is relatively a lifestyle friendly branch compared to some surgical branch or emergency branches. Your emergencies are less. Uh, uh, Mostly at JJ, we are having like three to four on calls, 24 hours duty in a month. So emergencies are very less. Mostly emergencies are like suicidal attempt or panic attacks, or person is in acute psychosis or substance withdrawal. So these are the things, or patient is in delirium. So these are the emergencies that mostly you face. And um, but in general, psychiatry offers more predictable working hours, especially after your MD. Also, when you do your private practice, also you will get enough time for your, like for your hobbies, or for your loved ones, for your family. So you will get enough time for all of that. So if your priority is having a proper work-life balance, then you can go with psychiatry. Now, scope and career paths. So, after MD psychiatry, your career options are vast. Like, you can do clinical practice, you can go into academics or research, or you can do fellowships, like fellowships in child and adolescent psychiatry, or geriatric psychiatry, addictions, de-addiction psychiatry, or forensic psychiatry, neuropsychiatry, or physiotherapy training or something. So in India, per se, the awareness about mental health is growing, you know, and the demand for a trained psychiatrist far exceeds supply. So you can work in hospitals, or open your own clinics, or consult online, or even work internationally after clearing the licensing exam. Like, you can clear MRC Psych exam, and you can practice in UK or Middle East, Dubai or UAE, and there you can earn more and having a better lifestyle than, like, better lifestyle than India. So that is another aspect. Okay. Now, another thing is that who should choose psychiatry. So choose psychiatry if you were curious about the mind and behavior, and if you have patience to listen to people without judgment. So, and if you're okay with ambiguity, or if you understand that progress can be slow but meaningful, do not choose psychiatry just because you think it's easy or a chill branch, and do not choose psychiatry if you hate listening to people, or if you have no interest in reading beyond your residency, because psychiatry demands ongoing learning, because the field, like, changes constantly as neuroscience and therapy research advances. So it's a ongoing learning thing. Another thing, that uh, the final words, I could say that psychiatry is not a branch for everyone, but for those who resonate with it, it's deeply fulfilling. Like, it will change lives in a way that cannot be measured in lab reports, right? So you will witness recovery, relapse, resilience, and everything in between. And your patient will teach you about courage, vulnerability, and the human conditions. And in return, you will offer them something that is often in short supply, that is understanding, hope, and a path forward in their life. So if you're thinking about psychiatry, walk in with open eyes, open mind, and, yeah, willingness to learn every single day. Because, again, I would say that here the most important instrument is not your stethoscope, your mind, and it's you. So that is it for today. And if uh, if you are thinking of choosing psychiatry in this year, then, and if any more doubts, any more aspects you want to specifically know, then please DM me, and I will solve your query as much as I can. So, yeah, all the best to every NEET PG 2025 aspirants for the result, and thank you so much.